In 2022, a diverse 11-member funding group came together to support a project that would help the Central Iowa community learn how to effectively support hardworking families who struggle to meet their basic needs. Born from this funding group came Iowa's first basic income study, UpLift, the Central Iowa Basic Income Pilot, with the goal to better understand how a basic income impacts Central Iowans' health and well-being. Participating in the study were 110 randomly selected individuals living in Polk, Dallas, and Warren counties. Due to the geography of Central Iowa, UpLift was uniquely positioned to include representation from the metropolitan, micropolitan, and rural areas all within a single study.
Well, if we'll recall, all these years ago, I had just started at Mid-Iowa Health Foundation, and I was meeting with my board chair, and he said, "Hey, so what are your big ideas?" And at the time, I had been reading a lot about these basic income pilots or guaranteed income pilots that were popping up across the country. So there was really this interest I felt on this national level about this type of research. When I thought about what our priorities were as an organization and that we were interested in being data-driven, we had this commitment to addressing the social determinants of health, what we would later call the social drivers of health, but also an interest in addressing systems change, so impacting health at a population level, not just talking about individual health outcomes. The idea of something like a basic income pilot for our community seemed to align really well with what our organization prioritized. So it was really refreshing to be able to kind of take this kernel of an idea and then go out to the community to see if they were interested in trying to participate in this type of initiative in our community.
For the work that we do and that we engage community with, I think it's a natural conversation that leads to ALICE, asset limited, income constrained, employed individuals in our community. So we know, and I know you know, that we have 33% of our population that are not able to survive. They're making impossible decisions between food and rent and childcare and so many other things. And so as we look at that, I think the findings from Project UpLift will help us look at how we pronounce to the community the importance of us understanding that when you think about 92,000 households in Central Iowa that are ALICE, that's the equivalent of Ankeny, Waukee, West Des Moines, Bondurant, and Indianola. So all of those households would be on a survival budget. So I think the work that Project UpLift is doing can help us expound upon the real aspects of what people are facing in our community.
By supporting UpLift, Windsor Heights is really helping find solutions, right? This gave us the opportunity to giving participants the freedom to pursue better jobs, better education, to care for their kids and their families without fear of financial collapse.
Convincing others that we're going to invest in something that's going to take us some time and it's going to take some research, but it's going to actually give us information to be able to really, really hit home on the thing that we want to make the change, and not just the surface change, but like the deep-rooted change.
I think we were, so Annie Brand, who also works with me, when we heard about it, we were both really excited. I think it's a little bit different, right? And it's ground up, and I think it's a bit outside of the box. So people weren't maybe as aware of it or the concept at the time, but we were really excited to be part of something that was outside of the box and groundbreaking, and that really could address systemic problems.
Part of the goal, we're in the business of solving problems and serving our residents. And this was an opportunity to help people immediately, but also think about how we do that in a better way. And we should always be looking to be data-driven, data-informed, and this was a way that we could have an immediate impact on a number of residents and then think about how we could have a better impact over the long term, how we could better use what is frequently very tight dollars in terms of solving problems, in terms of investing, giving back to our residents. This was a way to think about how we can use those dollars more effectively in the future to have the biggest impact and be most effective at the goals we're trying to accomplish.
So right after Let's Do It was some skepticism if something like that could be done in central Iowa, particularly in the way that Dr. Nalo had conceptualized it, covering urban and exurban, suburban, rural areas. She had the idea of bringing as many sectors of our community along for the ride as possible. So private funders, public sources, municipalities, right? And other nonprofits. If I wasn't aware of any funder collectives or collective action in that way around a project like this. And then my last thought was, oh boy, what a story we'd be able to tell as a community if we were able to pull it off.
In the fall of 2022, recruitment efforts for the pilot study began through collaborative conversations with local community-based organizations and businesses to help support outreach efforts across the study's area. In order to reach as many communities as possible, the project coordination team worked with several community-based organizations to understand what types of support they needed to be able to share the information about the pilot with various communities. From those conversations, the project coordination team worked with a local translation team to provide recruitment materials in 10 different languages, implementing safeguards to prevent financial abuse, and worked with trusted community leaders to craft messaging. To be eligible, individuals needed to be 18 years or older, live in Polk, Dallas, or Warren County, have a household income at or below 60% of AMI, have a dependent living with them up to the age of 25 years old. With this intentional outreach, over 50 community-based organizations helped with the recruitment of the pilot's participants. When the study's application opened in February of 2023, the study received over 6,000 eligible applications in just 10 days.
But I think one of the things that I'm most proud of is the engagement of all communities within our community and the true intentionality of how individuals were engaged even as part of the application process. And I think it truly represented what I think of when I think of community participatory-based research and the focus on funding local organizations who have the relationships to get the word out. I think that whole process should truly be a model or framework for how future foundations or research is done with and by or for community members. And I think that's something that I think we will take forward in how we proceed with how we fund things, but truly one of the things I'm most proud of.
So the UpLift project first came to us in helping to both promote it and to help recruit people that would be part of it. So as a food pantry network, we have access to a lot of folks who are struggling one way or another financially. With food insecurity, there's usually 5 or 6 other things that folks are facing as well, and thought that would be a really good key population to recruit for participants for this program, and so we were happy to step up. When we look at the universe of roughly 80,000 unique individuals that will have come to one of our 14 pantries across the community, a big chunk of them are children. Roughly 37% of those getting the assistance are children in homes, so it's a lot of working families. More than 40% are usually working people. Folks that have jobs, they're just not making enough to get by to meet the cost of living, which has continued to rise while salaries really haven't. So they're facing a lot of different challenges, some of them more unique than others, and it's just this really kind of interesting melting pot of people that just aren't making enough to get by.
Yeah, we were thrilled to be asked to partner to be able to get the word out to the families we serve. And we serve thousands of low-income households in this area. And so we were able to put together a mailing and package to go out to those families. And so it was targeted right towards the families who would benefit the most from it. When we had calls back, the most typical reaction was, is this real? Is this a scam? I mean, because it sounds too good to be true. but then being able to assure people. And for the most part, people were very understanding about the fact that this wasn't a limitless resource. I mean, we sent out 10,000 letters to people who would qualify, and we got no calls that were negative in any way from the population we serve. They were understanding it was a research project. They were understanding that they may or may not get selected. And overall, it was, I think, a glimmer of hope for people who realize the reality every day of what it's like to grind through poverty.
As the director of the By Degrees Foundation, we work very closely with our public schools to identify all of those different resources and opportunities that might be in the community and help our families learn about them, gain access to them, understand what is out there. So in my work with By Degrees Foundation, I was made aware of this project that was trying to get off the ground that focused on basic income. And I was immediately drawn to it because we see so much with the kids that we work with that just having a little bit of extra income would make such a huge difference for our families. And so that's how I got connected with UpLift and learn more about the project. And so we worked really hard to help our families understand what this is and sign up for the lottery in order to be a part of it.
So again, in doing all of that early reading and what was occurring elsewhere across the country, one of the early research teams that came forward as leaders in this field were Dr. Amy Castro and Dr. Stacia West at the Center for Guaranteed Income Research at the University of Pennsylvania. So I remember holding an early meeting with them to just kind of learn about what their study design was like, how many other communities they had helped support, what it would take from a budgetary standpoint in order to implement that study design within our community. And it was really helpful, to be able to have concrete understanding of cost, but also know that they had supported so many other communities that this wasn't going to be something brand new for them, that they had an established protocol. We would have the potential to have our data be compared across all the other sites that they were supporting as well. And so that was really attractive, rather than just going with a research team where it may be the first time they were trying to put a randomized control trial like this together. It was also really important, again, given this community-based participatory research approach, and wanting to have our local research institutions also engaged. So we ensured that the public health department at Des Moines University would be on the ground research support for our UPenn research team, and also that project coordination would be led at the Harkin Institute out of Drake University. And that piece was really critical because we wanted to make sure that our community partners were just as engaged with this project as the research components were.
So CGIR, the Center for Guaranteed Income Research, started in 2020 when we saw this rise in interest from a number of communities that were interested in experimenting with unconditional cash for many reasons. In response to the COVID-19 pandemic, in response to persistent and seemingly intractable economic inequality. So what CGIR does is partners academia with community-based organizations and local governments. And our real charge is to help understand how unconditional cash works in various different communities, so and for various populations. So what we do is produce really high-level, rigorous research that partners mixed methods, so both qualitative research alongside quantitative research, so that communities can better understand how unconditional cash may drive outcomes for specific populations.
If you think about the policy space and the safety net, we typically have community-based organizations or elected officials sort of introducing new programs, interventions, pilots, policies, all these different types of things, but we very rarely attach science to it, right? And so when we do that and we skip the step of understanding who it works for and how, then what we tend to be doing is designing policies and programs based on conjecture, ideology, rather than figuring out what works and who does it work for and how. So really what our goal is as a center is to provide organizations and policymakers with evidence, sort of like strong evidence-based data around unconditional cash in order to inform policymaking.
So we have measures about housing and perceptions of child development within the family, mental health, perceptions of well-being, adult mattering, so how much do you think you matter to those people who you interact with in your life, perceived stress for you and your household and your family, measures of food insecurity, just a lot of measures that tap into the many ways that it's possible that additional income might impact a family.
Where this momentum on unconditional cash or guaranteed income has been coming from, which, until the past few years really has been concentrated on the coast or in large cities and has really left the Midwest out of the conversation. And so if you think about, again, wanting to understand, the evidence around unconditional cash, you can't just study things in one location and expect it to apply everywhere, right? And so one of the things that's the most exciting to us about working with UpLift is the fact that it centers the voices, the experiences, and the data of people from Iowa. And it brings Iowa into this larger conversation around unconditional cash and helps us lead from the middle.
Following the research team's randomization of both treatment and control group participants, the project coordination team offered one-on-one onboarding sessions to all 110 individuals receiving the intervention. To prepare the individuals for the next 24 months of payments and surveys, onboarding sessions included benefits counseling, a review of how their data would be used throughout the study, and information on how to use their prepaid debit card where they would receive their payments. On May 15th, 2023, UpLift participants received their first monthly income payment from the study.
It is so critical if someone's getting a needs-based benefit, whether it's Medicaid or supplemental security income, to understand when they're getting any sort of other cash payment, how that's going to affect their benefit. Because it can be easy to say, I'm going to give you $500 a month and that's going to positively impact you, when that could really, and in some cases when we were projecting, it actually was going to give them a more negative financial situation. And you wouldn't immediately think that unless you understood all the very complicated rules. And so that's why it was so critical, because we wanted people to make an educated decision.
A lot of people won't even take a raise or a promotion because they know if they earn at a certain level, they may be no longer eligible for, let's say, health insurance, or they may lose the food assistance, or especially childcare that has such a low income eligibility level that if they start to earn more money or have that stipend kind of thing with the UpLift project, you could lose out on those kind of supports.
Being an advocate, every legislative session, you try to plan as best as you can for what to expect, work on bills that you want to see advance, try to prepare for bills that you don't want. And I think this, frankly, I was a bit blindsided by this bill. I didn't expect to have a basic income preemption bill, come up to have to deal with. But, I've been doing defensive advocacy around SNAP for probably going on 8 years now. And we see a lot of attacks on public assistance programs. We've seen that over the years. And specifically one group, for a Florida-based think tank, that really came into the state of Iowa in 2016 to start pushing quote-unquote welfare reform bills around SNAP and Medicaid. I worked really hard along with coalition partners to try to fight back against that bill. Unfortunately, it did pass and was signed by the governor. So that's definitely a setback. And I think we've seen this type of preemption legislation before, not related to basic income in the past, but I mean, we've seen it when counties have tried to raise the minimum wage, certain housing policies that cities and counties have enacted, community ID programs, and I think that this state preemption legislation, it really inhibits innovative policies because it doesn't allow for cities or counties to try something out on a small scale before testing it out for a statewide program. When we think about policy development,
You want those pilots to study and see how things work and learn best practices before trying to do anything large scale. Or maybe you find from a pilot, hey, this isn't the right approach. Maybe we need to look at something different. But by just shutting things down, before they can even get started, I think it really does stifle innovation.
Things were so great, the movement was great, the community interaction was great, and to have our own state step up and say, no, local governments, local communities cannot support this kind of effort was so disheartening and so unnecessary. And I never imagined that that would be one of the outcomes of this, that there would be governmental officials who would stop locales from taking action against poverty.
What we're concerned about is the legislature continuing to take away from us the opportunity for local control. And that is so important, because what our task is to make the lives of the people in Windsor Heights better.
That saying, when you take 2 steps forward, there's always that obstacle where you take 3 steps back. That's the type of situation that I was in, where I was, like I said, I was working in the corporate world for 6 years, to where every time I felt like I was ahead, I was always taking that 2 to 3 steps back. So participating with the UpLift program, I was able to resign from my corporate job, and I was able to start my LLC, so then that way I could be able to start that generational wealth for myself and my family. So once I obtained custody of my 2 grandchildren, and working a 9-to-5 just seemed impossible, because I had doctor's appointment, therapy, things, court dates that I had to attend, where I had to be available to. So therefore, I had to make that hard decision, to where it was causing me health issues, where high blood pressure, anxiety. So I had to make that hard decision to be able to resign, and having that discipline and confidence within myself that I could be able to start that LLC, so then that way I could be able to work on my own terms, and also being able to make those financial resources come in, so I could be able to take care of myself and my family. As I'm sitting here right now, after this interview, I will be attending the Drake Accelerator class. So that's what I am doing to prepare myself as exiting the program. We're just building up, my educational skills to be able to run a successful business.
I just started making a list of just some of the results from this. So some of the bigger ones, it allowed me to quit my second job. Like I mentioned, I had 2 jobs at the time. One was a corporate job, one was not quite as big, but it was still bringing in income, and so I was able to quit that and have more time to focus on my children. So that was huge, which led, like I said, to a promotion and more confidence and space in my life. Charitable donations, I was able to give away some money. Groceries, starting an emergency fund and a savings account. So I've never been able to do that since I was on a single income. It was just too difficult. Well, when I first started, I was in survival mode. Mm-hmm. So it was definitely the needs of my kids. Mm-hmm. Being able to, feel some breathing room to provide groceries and not wonder if I would just get bare essentials, but, extra stuff. Toiletries, extra gas. I had some bills that needed to be paid. Just thinking through, like, okay, what am I going to do first? And then that's when I started making goals.
Okay.
But yeah, probably the most basic needs is what I put at the top of the list. Also, I think just sacrificing, like I said, my schooling. You know, I want to go for more. I love learning. I'll probably always be a lifelong learner. So that has really been empowering to be able to have that paid for and to finish even just 2 years, you know, about 11 hours a week with full-time job, full-time mom, you know, managing sports and whatnot, being able to say, okay, I did this, you know, it felt really, really good.
Knowing that I had 2 kids that depended on me and making sure that their needs were met with me not losing my cool, because I would be stressed out in regards to not having enough money to really take care of all of their needs. So that would have to be the hardest part, just the stress of like not knowing how I was going to do everything that I needed to do. Well, having the funds that were not limited gave me the space to breathe a little bit. And I was in a position that was a dead end position. I felt like I was really stuck there. And leaving a career, if you want to call it that, it was just kind of not a great company to work for. They didn't believe in you as a person. It was just about numbers, I feel like. And so I'd applied for positions and kept getting denied for, I never felt like it was a valid reason. And then having the income gave me really like the space or the freedom to know that I was going to be able to pay my bills and maybe leave where I was at. It really gave me the courage to take that first step. And I did. And I'm with a completely different company now. And I've moved up just in the last year.
Congratulations.
Thank you. And I've applied for different opportunities within it. Like I'm doing an apprenticeship and like with another department. And I've done training for, like they call it arena coaching. So I've been doing training with new hires and I feel so supported.
Okay.
And I can't even imagine being where I was 2 years ago. A couple months ago before the holidays, I was discussing or thinking out loud about going and getting my master's and finishing or continuing my education because I love to learn. And yeah, I don't feel like my journey is over, like I'm not fulfilling my full purpose. And I think that it gave me the push that I needed to see that. I think I have a lot of life going forward, and I think that being a part of this, the shifts in my personal life, and it has supported me through all of those, and it's gotten me to the point where I can continue the story without it.
In the time between being approached to participate in the project and now, we have drafted and approved a human services strategic plan for the city of Urbandale, which is something we've never done before. And I see us using the data that's coming out of Project UpLift to help us guide implementation of that plan.
We really hope that Windsor Heights can be an example to other communities and other small cities that you do not have to be big to be bold, right? You do not have to be big to be bold. You just have to care enough to act. And that's something that our council is very proud of, that we try to listen to the people in our community. What do they need, and how can we help them be successful in our community and in their everyday lives?
By Degrees Foundation has worked in public schools for 35 years. And we have made a tremendous impact in the lives of thousands of kids. But we still see so many limitations that are completely outside of our control. And if the UpLift project can inform policy that helps our decision makers restructure the way we utilize public benefits or restructure other economic opportunities, that sort of underlying economic stability is going to have transformative impact in education and in health and in our housing sector.
One thing that I'm hopeful for is that the public will see this and they'll say, we need to make change. You know, we're all Americans. We all need that at time to time. Everybody needs assistance. And there's nothing wrong, you know, with receiving public benefits. There's nothing wrong with wanting to make change. All of it is okay. You know, it's just a matter of let's inform people that we can do different things. We can try different things and make it work for that individual. It's not a one-size-fits-all situation.
You know, you just don't know the exact life that's going to be changed. So I would just say thank you and, you know, just affirm them that I'm already incorporating ways in my life where I can pay it forward.
Just thank you. Thank you. Thank you for hearing us. Thank you for building me up because it just definitely has touched me in a profound way that I wasn't expecting.
Because it's made a huge impact on my life. I know it's made a huge impact on the other people that have been a part of this program. Keep it up. It's beautiful, and it was a beautiful experience for me, and I think everyone should have the opportunity if they need it.
I think that at the end of the day, I think that this data is going to be shared far and wide. And I think we can all sit there and say, you know, we were part of that. So I'm very proud of that.
The goal of this job is to create a community that works better for everyone and provides opportunity to everyone. And that means we need to think about how we constantly improve everything that we do. It means that we need to be data-driven and willing to look at data to inform how we do things, and sometimes be willing to do things differently than what we've done before if there's evidence that we can do it better if we do it differently. And that's what this is about. It's about helping provide that opportunity to everyone in our community, and then trying to understand, is there a way that we can use dollars better, use dollars more effectively to have an even bigger impact than what we're doing today.
This project was never about we're yay or nay on the concept of basic income. It was the idea that we think data should drive decision making and that we should be innovative in our public health and human services space. So desiring to bring forth scientifically valid research data to inform our decision making was the one and only goal we had for this project.